No cancers.
No cancer.
No sausage.
Hey you guys, welcome to another week of the Mama and Minnie Show with Shola and Iman. This week we are giving you guys a crash course in breast cancer. Before we go any further, I want to make sure you guys like and subscribe and hit the notification bell to turn on our post notifications so you never miss a video from Mama and Minnie. October is Breast Cancer Awareness Month. Breast cancer is a disease that 1 in 8 women will be diagnosed with in their lifetime. It is very common and it affects all types of women from all different races, all different backgrounds, and all different class statuses. So cancer in general is when abnormal cells grow and invade the tissue in the body. Breast cancer is when abnormal cells grow in the breast tissue. These abnormal cells can be new cells that are unnecessary and not needed by the body, so they take up space and form lumps in the tissue of the body. Or it could be old cells that do not die when they're supposed to and instead clump together and form lumps. Some signs and symptoms of breast cancer are a change in the size, shape, or appearance of the breast, a new inverted nipple, peeling, scaling, crusting, or flaking of the areola, or redness and pitting of the skin over the breast. There is no one cause to breast cancer. Many women get it and many women don't get it. There are certain risk factors though. Risk factors do not automatically determine whether or not you're going to have breast cancer. Some women with risk factors do not get breast cancer and some with less risk factors do. Risk factors of breast cancer are being a woman. More women than men get breast cancer, although it is possible for men to get breast cancer. Your age, older women tend to get breast cancer more often. Your personal history of breast conditions and other cancers, your family history of breast cancer and other cancers, and whether or not you've ever been pregnant. Studies have shown that if a woman has been pregnant before, her risk of breast cancer is lower than a woman who has never been pregnant before. There are also other activities and risk factors that are linked to breastfeeding, like alcohol consumption, types of birth control, things like that. But it varies so much across the board. There's no specific reason why or thing that you shouldn't be doing. There's not that many options for really preventing breast cancer. One of the only ways to be sure you won't get breast cancer is to get a double mastectomy, which is when you get both of your breasts removed surgically, and you can get new breasts or you can just have them removed. Normally, only people with very high risk of breast cancer undergo this option and do a preventive mastectomy. Angelina Jolie famously had a double mastectomy because her risk for breast cancer was so high. Other than that, there's no really specific way to make sure you don't get breast cancer. Leading a healthy lifestyle by eating healthy foods, making sure you maintain your sleep schedule, not doing any crazy things to your body, and making sure that you incorporate fitness and exercise into your routine can help lower your risk of breast cancer. But like I said, nothing really can completely take the risk of breast cancer away besides having a double mastectomy. How do doctors diagnose you with breast cancer? If you have lumps or itchiness or pain or any of the symptoms that I mentioned in your breast, you should definitely make an appointment to see your healthcare provider right away. Once you go, they will examine you, and they can do that in several ways. There's a routine breast exam, which is easy to do on your own at home, and I will show you how to do one at the end of this video. They can also do a mammogram, which is an x-ray of your breast that shows them if there's any lumps or masses inside the breast. Ultrasounds are another option that doctors can do to examine your breast. And that helps them determine whether or not a mass inside of the breast is solid or if it's filled with fluid. They could also do a biopsy in which they remove some breast tissue and go and run tests on it and examine it. Or they could do a breast MRI and take images of your breast to see if you have lumps. Once you are diagnosed with breast cancer, the next thing to figure out is which stage your breast cancer is in. The stage that your breast cancer is in lets you know how far along and how progressed the disease has gotten inside of your body. Stage 0 is the stage in which the cancerous cells are still considered non-invasive and they are basically contained to the milk ducts. Stage 4 is on the other end of the spectrum. That's when the cancerous cells have spread away from the breast and have now entered other parts of your body. There are several ways to treat breast cancer. One way is to get a lumpectomy, in which doctors go in and remove the lump in the breast. We already discussed a mastectomy, where a breast is removed, or a double mastectomy, where both breasts are removed. Lymph node removal is effective when the cancerous cells have traveled to the lymph nodes. You can remove some of the lymph nodes or all of the lymph nodes. Those are the surgical options for treating breast cancer. Radiation and chemotherapy are two really popular ways of treating breast cancer. Radiation is when high energy beams are actually directed at the cancerous cells in your body to destroy them. Chemotherapy is when you take drugs that are aimed at killing the cancerous cells in your body. Once your cancerous cells are gone, you are considered to be in remission. The good news about breast cancer is that when it's detected early, there is a very high survival rate. The 5-year survival rate for cancer that is detected before it has spread to the rest of the body is over 90%. The 5-year survival rate for breast cancer that is considered regional and has spread to the areas near the breast is 86%. So it's very, very important to keep track of your body, keep track of what is normal for your breast, and to see a doctor as soon as possible if anything irregular is occurring. Because the sooner you catch it, the better your chances are of beating breast cancer. So first, you're just going to stand with your arms at your side in a relaxed position and just check your breast to see if anything obviously abnormal is happening, any scaling or pitting or pain. Then you're going to place your hands on your hips and lean forward, checking for the same things, obvious abnormalities. Then you put one hand behind your head or up in the air and you thoroughly examine your breast by feeling it. You're looking for any lumps, any hardened tissue, any pain, anything that's not normal. You're going to go up into your underarm area as well, and you might want to rub little circles in your breast just to make sure that everything is how it should be. You also should check the underarm area because lumps in the underarm is also a sign of health concerns. This is why it's good to do breast exams frequently. You should do them about once a month because then you'll know exactly what's normal for your body and what's not normal for your body. You're going to do this on each side. Then you are going to lay down on your back with a cushion underneath you and repeat the entire process, feeling for anything that's not normal in your breast and in your underarm area. So that was our crash course on breast cancer. Thank you for tuning in, and make sure you are subscribed so you get all of our videos, and we'll see you next week.
Bye.
Stage 0.
Thank you.
Follow us.
Follow us.